Greetings! We are the FLUNISOLIDE team and we are going to talk about us. We will discuss to you my drug name, my drug classification, pregnancy category, mechanisms of action, pharmacokinetics, my indications and contraindications, side effects and adverse effects, and the nursing responsibilities.
The generic name of the drug is FLUNISOLIDE. The brand names are Aerobid, Nasolide, and Nasarel. The chemical name is 6-alpha fluoro, 11-beta, 16-alpha, 17-21-tetrahydroxypregna, 1,4-diene, 3,20-dione, acetone cyclic, 16,17-acetal.
I am therapeutically classified as an anti-inflammatory drug, which means I suppress inflammation, then anti-asthmatic, which means that I help in the treatment and prevention of asthma attacks. I am classified as a glucocorticoid, which also acts to reduce inflammation and suppress immunity. My pregnancy category is C, which means the benefits acquired from me in pregnant women may be acceptable despite its potential risks, since there are no adequate studies to support the claim.
Mechanism of action. FLUNISOLIDE is a glucocorticoid receptor agonist. The anti-inflammatory actions of corticosteroids are thought to involve lipocortin, phospholipase A2 inhibitory proteins, which through inhibition are arachidonic acid, control the biosynthesis of prostaglandins and leukotrienes. The immune system is suppressed by corticosteroids due to decrease in the function of the lymphatic system, a reduction in immunoglobulin and complement concentrations, the precipitation of lymphocytopenia, and interference with antigen-antibody binding. FLUNISOLIDE binds to plasma transcortin and it becomes active when it is not bound to transcortin.
There are two mentioned routes of administration, intranasal and inhalation. In the intranasal route, my onset is slow. It takes about 10 to 30 minutes to reach my peak. My duration is 4 to 6 hours. In the inhalation route, my onset is fast. Peak and duration is unknown. I am metabolized in the liver and excreted from the body in the feces or urine.
FLUNISOLIDE is indicated through intranasal for relief and management of nasal symptoms of seasonal or perennial allergic rhinitis. Through inhalation for maintenance treatment of asthma.
Now, let's go to my contraindications. I am contraindicated to patients that are hypersensitive to the drug, patients with systemic fungal infections, untreated local nasal infections, epistaxis, nasal trauma, septal ulcers, recent nasal surgery, and use cautiously with pregnancy, lactation, and status asthmaticus.
The side and adverse effects of FLUNISOLIDE. For central nervous system is headache with nasal inhalant, irritability, fever, dizziness, and nervousness with oral inhalant. For the skin is urticaria. For the endocrine is the HPA axis suppression, the Cushing's syndrome with overdosage. For the gastrointestinal is nausea and vomiting with nasal inhalant, abdominal pain, decreased appetite, dry mouth, diarrhea, nausea, vomiting, and upset stomach with oral inhalant. For the eyes, ears, nose, and throat, nasal irritation, fungal infection, dryness, sneezing, epistaxis, and watery eyes. For the respiratory is epistaxis, rebound congestion, perforation of the nasal septum, and anosmia. For the cardiovascular is edema, chest pain with oral inhalant.
Now let's talk about my nursing responsibilities.
Before administering the drug, assess for possible contraindications and cautions like acute asthmatic attacks and allergy to the drugs, which are contraindications, and systemic infections, pregnancy or lactation, which require cautious use. Perform a physical examination to establish baseline data for assessing the effectiveness of the drug and the occurrence of any adverse effects associated with drug therapy. Assess temperature to monitor for possible infections. Monitor blood pressure, pulse, and auscultation to evaluate cardiovascular response. Assess respirations and adventitious sounds to monitor drug effectiveness.
During drug administration, be alert to signs of hypokalemia, which include muscle spasms, cramps, tetany, circummoral numbness, and seizures. Provide comfort and safety to the patients. Ensure maintenance of emergency drugs and equipment at bedside table to promote prompt treatment in cases of severe toxicity. Then, educate the client on drug therapy.
After drug administration, monitor patient response to the drug. Monitor for adverse effects like nasal irritation, fever, and GI upset. Evaluate the effectiveness of the teaching plan. The patient can name drug, dosage, adverse effects to watch for, specific measures to avoid them, and measures to take to increase the effectiveness of the drug. Monitor the effectiveness of other measures to ease breathing. Monitor clients' compliance to the drug therapy.
That would be all.
Thank you.